matter. This is Kim Muchow, permit me to, and we are actually going to be doing the Board of Health meeting. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Vice Chair Jeffrey?
Yes.
Member Diane Dodaro?
Yes.
Staff, when I call your name, please respond in the affirmative. Health Director Kathleen?
Yes.
Health Agent Jenny?
Here.
Yes. Public Health Nurse Alicia?
Here. Yes.
Regional Inspector Carrie?
Here.
And intern
Tess.
Tess. And on record, we also have Steve Sherlock here from Franklin Maps. And we are recording this. All right. Citizens are welcome to express their views for up to 3 minutes in a matter that is not on the agenda in compliance with Chapter 30, Section 20, the Open Meeting Law. The Board of Health cannot engage in a dialogue or comment on a matter raised during citizen comments. The Board of Health may ask the Director of Public Health to review the matter. Are there any citizen comments? As I look at Steve.
Yes, Steve Sherlock, 13 Magnolia Drive, Community Information Director, Franklin Matters, Franklin Public Radio. Welcome the Health Department to Facebook. I saw that post recently. I'll be following it, and as you add additional things, I'll be sharing it out accordingly. And if you have any other ideas in regards to what you want to do with it, I'm open to provide some insights from what I've understood of the community and how to interact. So open to that. So thank you.
Thank you. We appreciate the publicity on it, and we also thank you for helping us publicize the Women's Health Expo and the mammogram, which we're going to talk later about, but I think it was also key that you were right in the trenches with us, publicizing everything.
This is goodness for the community. The community needs to know us, and that's part of our overall charters to amplify the public good. So we're here to help.
Well, thank you.
Thank you.
All right, approval of the minutes from May 6, 2026. I had one typo which I gave to Kathleen already on the just spelling of a name.
You have the typo.
Does anyone have a motion to approve the amended?
I make a motion to approve the minutes.
I second it.
Is there any discussion? No. Okay, Jeff, how do you vote?
Yes.
Diane, how do you vote?
Yes.
And I vote yes.
For the record, as amended.
As amended. Thank you for keeping me honest. All right, so let's move on to the update on the warming and cooling shelter discussion. Kathleen.
Yes, so after discussing the situation that we don't have a warming or cooling shelter on Sundays, now that the library and the library is closed and the senior center is not open, I reached out to the interfaith community, and New England Chapel and the First Methodist Church have agreed to split a schedule during our cooling and heating times that we need a shelter. So New England Chapel is ready to go. Their doors will be open when I need. They have their volunteers already. And so I'll be reaching out to them. Well, I reached out today because we're going to have severe heat over the next 7 days. And so we'll be getting that going. Yep, so I shared a spreadsheet with Reverend Jacob Jecka and Pastor Cliff Winters, and they will fill in their schedule for me. But this kind of hit hard first. I didn't even realize we were going to be having extreme heat because we've been freezing.
Yeah.
So then I'm going to have Tess work on some social media for our cooling center and get that out on Tuesday.
And then will they be able to have communication back to the police and fire to know that when the cooling or heating shelters are open? I know we do that for pathways, so that if there's a problem and there's an emergency call made at that time, they know that people are in the building and the situation, because that's always key for them to know.
Okay, I'll let them know. Thank you for that.
Yeah.
I didn't even think about that.
Yeah.
That's great.
Question. So if it's, what's like the threshold? If it's 85 and higher, it will open, or 85 and higher for 3 consecutive days, then
85 and higher consecutive
Yeah,
days.
3 consecutive days. So we have the 3 consecutive days, but Sunday it's
It's
going to
gonna
be
go-
76, so
So
not
they don't
needed.
have to open.
Okay, got it.
Although, I don't know, Kathleen, if we're talking about, we're lucky on that one, but if it was the day number 3 and it was 85, should we be opening? Because it's weird, because like for the cooling, it's 30 degrees or below.
That's it.
Versus this one, it's like you have to have 3 days. Well, people are going to be really hot on all 3 of the days.
But Sunday, hypothetical, may be the beginning of the 3 days. So, yeah,
What times are they going to be open from?
8 to 5.
8 to 5?
I think New England Chapel is going to do like 8:30 to 4:30 because they have youth group starting at 5, so they want to just make sure that.
So what do they do? Just tell everyone they have to leave?
At that point in time, because it's kind of like when the library closes on Saturday because they're the cooling shelter.
Well, at least it starts cooling at that point of the
Yeah.
day, like 12 is like the hottest point, you know?
By the time it's
It's
getting to
something.
8:30, it's cooling off a
Yeah.
little bit.
It's just it's temporary, you know. So, yeah, I think we're gonna have to, since this is our first time doing it, we're gonna have to kind of
Play it by ear?
play it by ear.
Yeah.
Yeah.
They're going to have like water and food and
So
stuff? How's
they're
that
not
gonna
going to. So if you go to the library, there's no food. So what I had basically told the churches when I went to the Interfaith Council was, coffee, water, tea, and leave it at that. The bare requirements is you basically have to have heating or cooling.
Right.
And several of the churches don't have cooling, which so a lot of them couldn't participate.
I think it's great that the church is doing it. That's awesome.
And then at New England Chapel, there's a TV, so I don't know who has a Google account, but you can sign on to Google TV and watch things. Otherwise, we can stream our services.
Is there any chance that we can donate any water to the churches at all to?
Sure, yeah.
Well, so New England Chapel has a water fund that does filtered water,
Oh, okay.
so they can always do that. And then since it's on a Sunday, they're just going to leave up the coffee and the tea that they make. So it just makes it
That's good,
hot
yeah.
water and stuff like that.
That's awesome, yeah.
So that's all set now.
Jacob might want to do more once his kitchen is open and do meals and stuff along those lines. But, his kitchen isn't open quite yet. He's still doing construction.
Yeah. All right.
All right. And congratulations on the Facebook page. If you can give us a little more details.
So Liz is our new marketing person, not fairly new, about 6 months, maybe 8. And she sees all the good work that Alicia puts out there, like CPR and Stop the Bleed and all the things. And she asked me if I would like a Facebook page so we can get our information out there on social media so the public will know what we're doing, So I said you need to, ask Jamie. If you get permission from Jamie, then absolutely. And so Jamie agreed, and so we started working on it last week, was it?
Yeah, I think just
I think we set up last Tuesday, Wednesday, Thursday, I can't remember now. It's pretty busy week.
Yeah,
So the 3 of us just sat in a room together and we put it together and
Yep.
off we go. So
Cool.
it kind of adds to our plate in another way. So
It does.
It
But
does.
that's why a lot of the things are like, we'll post the stuff we usually do that I would send to Liz anyway to post on the Franklin page. However, like we're doing alerts now, like the heat wave coming up. AED week is like this week. We can do some of like the health, like the monthly health observances and information linking all if people want to learn more.
I think you're going to get more people looking at that than you're going to see on the Franklin page.
That's what I said.
Absolutely. You're
Oh,
going to
well,
see
yeah,
so
on the
many
town
people
page.
are on Facebook, and especially even, older people go on it.
Yes.
Well, and it's another reliable source for like our health fairs and
Yeah.
I wish we had it for Women's Health Expo.
Right.
We'll talk about that more later, but we rely on just sending our stuff to police rec department, asking them to put it on Facebook, and then we have the message board up at the middle. So now we have another more reliable avenue to get our information out there.
Is it called Franklin Board of Health? Is that the
Franklin
Franklin Health
Health
Department.
Franklin Health?
Yeah. Yeah. So we're kind of excited about that. And Liz is right. You know, we get in public health, we just do our jobs, right? And we don't really think about letting the public know what we've done. And so, like she said, you know, all the information that we were doing about Kratom, she was, you know, should have been out there, right? And educating the public and such. So we're just moving forward now.
Yeah.
Yeah, we can't go backwards, so we're moving forward. Yeah.
Well, thank you for all that hard work. I noticed it right away and I loved it.
Good, that's good. Yeah, Alicia, she did a great post.
It's getting
too,
some
explaining,
traction.
Yeah. We do have to run, so, you know, we do have to run everything by Liz, which has got a little bit more on her plate too. But
Yeah.
after a while, I think we'll kind of.
Yeah, we're starting off that way to make sure everything is like 100%. Like even today when I posted something, she's like, "Oh, you need to trademark that stuff." I don't know. You know, so it's
Yeah.
good to have her help us.
Oh, yeah.
Oh, good.
And I guess there's ADA compliance with what you
Yes,
post
because
too.
everything I post is not ADA compliant.
Yeah,
Not anymore, but it was.
yeah. So it's a learning curve for us, but that's all right.
How does it become ADA compliant?
I was doing QR codes, and you shouldn't do QR codes.
Which is huge.
Both text or images, so that people with readers can have it read to them.
Oh, wow.
Otherwise, an image, there's no translation for it.
Right, yeah.
Yeah.
Well,
The world has changed so
yeah,
much.
no kidding.
All right, can I move on?
So, how about an update on our Women's Health Expo?
It was really good.
Do we know how many women got mammograms?
I emailed her last Wednesday morning, and she has not responded back to me yet. 17 people were signed up, though. So
Okay.
I'm hoping at least all 17 came and got them done, but I did email our contact person from Dana-Farber to get an update and have not heard back from her.
I was gonna update the,
I'll send
town
her a
council,
follow-up
so
email tomorrow.
if
and
I
just
don't have
ask
anything, I'll
her.
say about 17 women.
The they've been wonderful, but the communication has been
Yeah.
more on the difficult side.
I would just stick with 17.
Yeah.
For now, and we'll try to get another update. But I think I should have had like a counter or something, but we were so busy. Like even my station had like a line of people to get blood pressures and blood sugars, and I was like, oh wow, this is crazy, because I do them all the time at the senior center and don't have lines, and we had people waiting to get them done. But
It was good vibes. Even when we went in, it was like really good vibes.
the
We just had
vendors
a
thanked
blast.
us. They were
Vendors
like,
were
let us know,
phenomenal.
we'll come again.
Yeah. And I try to go to each vendor and introduce myself and thank them for coming here and supporting us. And they were loving it. They were like, this is good vibes, you know? So,
Yep.
yeah.
Yeah, we had free snacks from Wegmans to, I know.
And almost all the snacks got eaten.
Yep.
And I
Healthy
missed,
snacks.
I missed all that.
You
Yeah,
did.
I know.
See?
Free snacks. Oh, they had what was that body composition scale? They had
Oh,
a
it's
body
a-
composition
Deluxe.
scale. I was too afraid to get on.
What were we going to do? We were going to do one leg, I was
Oh,
going
yeah.
to do the other.
I know, she's like, do it with me. I'm like, no, we're not going side by side with each other.
But just,
Just she works out all the time. No.
just so you know, when we do a community engagement like that, I applied to Wegmans for food money for assistance for our community programs, and we usually get about 200,
250 this time.
250, yeah. So that way we can buy snacks and that stuff. So
And they
thank you to Wegmans.
They all went. I was amazed.
Yeah.
Yeah, and we had a lot of really cool vendors, like
Yeah.
different ones this year.
No,
too.
I took cards.
Yeah.
It was that great, yeah.
Yeah, because I think the Arthritis Foundation is willing to do talks in the area, so I took a card to take to the senior center so that she can do a presentation just at any time.
Nice.
And then, I don't know if you remember Candace Richardson, the COO of EMK.
Yeah, yeah.
She got married the Saturday before,
Oh,
came back off vacation to come to the health thing, and then was leaving on her honeymoon on Saturday.
Oh my gosh.
I mean, I was like excited, just like, wow, we really made it if you came back. Because I had sent her an email, and it's like, oh, I'm on vacation till Wednesday. Going, but that's the health expo.
And it was such a hot day, and we still had so many people come out.
It was great.
That's
Yeah.
great.
And people were a little bit confused because of the van.
So there, I do remember talking to someone at the senior center afterwards, and they thought it started at 10 because of the 7 to, and then we did have one lady show up at noon, but she came back at 2 when I told her, no, it's actually, so we need to figure a better way of doing it so that we can clearly say the expo was actually on these times.
We did even 2
But
separate
people were
flyers.
like
Yeah.
confused.
We'll figure that out if we do it again.
Yeah, the problem is with the van, they had such specific times. And
Yeah.
we'd like to do ours a little later to try to get people who might get out of work. But I have noticed that 4 to 5 is kind of a lull
So
compared to in the beginning.
Maybe we should start looking at more like 10 to 2 or
See, I get
1
nervous.
to
I feel like I've
3.
done like a 10, remember the
10 to
baby
2 is
shower?
really good because you get a combination of everybody coming, you know,
Might
early.
have a lull during lunchtime
Yeah.
or something like that. If we do something like that, I think for a health fair, we'll stick with our normal.
2 to 3 though is very busy.
2 to 3 is
2 to 3 is very busy.
So maybe do noon to 3,
Yeah.
because people were showing up at noon thinking that it was a good time, because you know, you
Yeah.
can come on your lunchtime
That's
and go
true.
through.
That's true. Yeah, good.
I did talk to Manny, who is the driver of the mammogram van, and so we may want to think about this for next year potentially, but supposedly Dana-Farber also has a van that does screening for skin cancer with a dermatologist. I couldn't
That's
find
nice.
anything online with them,
I have it
Good.
now,
Yeah.
but I think that would be good just to research to see if we could qualify for that as
I
well.
think that's great. People
That
don't
is
do
a
that
great
enough.
idea.
No, they don't.
They
How many
don't.
people don't get checked for that, you know, because they don't think about it or they don't have the money to go to a
Well,
doctor?
it's a specialist visit. It's not considered preventative care.
Yeah.
Like unless your primary care doctor is doing it to go and see a dermatologist to get a full body skin check, is a specialist.
Yeah.
So
Yeah, so I put an email into, it's the same email as Tia, so and it's been a week, so it might be.
they're probably very busy.
Well, but we're
you know?
also looking
this time of year is
at
busy.
next year, and they're probably all booked for this year, so.
Yeah, right, exactly. And hopefully we're in there, we should be in there.
We should
get cash, yeah.
But it was also good because on Facebook when we posted it, people were asking. I think we tried to tell everyone that it was there, but going, we didn't hear about it. I would have done it. So one of them had said, well, how do you get on it? So I had talked to the staff, and we put back on Facebook, this is how you do it. And one woman wrote back, I booked my mammogram on the van at another town. So I think that's been good. So at least 18 people in the Franklin area are getting mammograms as a direct result of this. So it's very good work, guys.
And it makes people more comfortable about getting it on the mammogram van. Like if it's the first time of hearing about it or seeing it, you're like, oh, I'm a mammogram on, you know what I mean? But now people will see it, see how cool, it's a huge, really high-tech van.
One woman was raving about it, about what a wonderful experience it was.
And it's so quick, 20 minutes,
High
you're in and
tech,
out,
yeah, so really good review.
Yeah.
Yeah, so thank you.
Hopefully we can do it again next year. But now we're old pros at it, so it'll be easier.
Yeah.
And we know that they're not good at communication, so we're not going to bother them as much.
Yeah.
All right. So the next thing is a discussion about banning body works establishments.
Yeah, so, and this is just our first discussion, because after speaking to Mark, our hold on, sorry. I just had it up. One sec. What's going on?
I hate it when it does
That's pretty cool.
That is really cool.
Yeah. I've never seen so many of you.
I don't know.
click to one of your top tabs.
Yeah, which one do you look better in? Let's see.
This one? I don't know.
Your top menu bar.
Up here?
Yeah. One of those tabs is already open with it?
No.
No?
I just had it up. Oh, well, whatever. It's not gonna work.
Lazy doing that. What's going on?
I didn't leave the stove on or nothing.
You look too far away for it to be.
One sec.
You're in the wrong part of town.
I know.
Okay. I'm not gonna try and share it, I'm just gonna put it up here. So, a couple things, but I just wanna get the, okay, right here, this is what I wanna look at. So, all right, so Body Works has multiple definitions, and we'll get to that at a later date, but I just want to give some history to our next discussion. So I think both of you know, but I'm not so sure, Kim, if you knew, over the past 3 years probably, I think, we have had 3 bodywork, well, 4. We've had 4 bodywork establishments. And before I wrote regulations, I would be called out to a site by police officers that they would find people living in a massage bodywork facility. They would have full kitchens, bathrooms, bedrooms. And ultimately, we shut down 3 of them, okay? One right out here, blatant, growing a garden, had a gas grill. There was 6 women in there.
Wasn't that the foot place?
Yeah. So that was 3 we shut down. Then I wrote regulations, which the board approved of, to try and, first for enforcement reasons, so, I wouldn't have to rely on the detectives to get me in there, but also for them to have strict regulations. And so another place came in, and they did everything. They complied with with the regulations, and didn't we find them a person living there once again, and had them before this, not this board, but you and the other board, several times, Lily Spar,
Yep.
about massage.
I remember them coming in and swearing they were never going to do anything.
Yeah, never. It's always never. So anyways, I was talking to Kim, and I said, I don't even know why it came up again in my head, but it came up again in my head. Oh, I know, because of FIFA. I spoke to the Attorney General's office. There's a sex and labor trafficking task force, and I spoke to her about my concerns about FIFA, which we'll talk about probably maybe under new business. And it got me thinking about how upsetting this human trafficking is, and young women are lured from other countries to Flushing, New York, and then they're trafficked to, they don't even know where. They don't even know they're in Franklin. And then I come in and I close these places down and watch these women who can't speak English walk up the street with their goods in a garbage bag, and I can't help them. And it's really disheartening. And so I started thinking, I don't have any right now. So why don't I just make sure they don't come around again? Let's ban this bad behavior. So I did talk to Mark Sorrell this morning and Jamie, and we talked to Tech Review. And basically, and I don't know if I can do this, but I'm going to try, like Kratom, we have to have a significant public health threat in order to ban something. Right? So we knew we had the facts about Kratom and what that can do. I need to come up with a significant public health threat in order to do a ban. Some towns do zone them out, or zone them to, like Body Art is at the industrial park, right, making it undesirable. But Jamie thinks that the Board of Health it would be an easier ask. So that's why I'm saying more discussions, because this is gonna be on me to come up with a concrete, actual fact that it's a public health threat. And so I've got to work on that.
Isn't the fact that it's illegal just enough?
What? Is it? I mean, well, because Jamie says, because it's a Body Works establishment,
Prostitution.
that I'm making an assumption that there's human trafficking, prostitution going on. When indeed, they were doing foot massages, but come 9 o'clock at night, the back door was open for other things.
Right.
How do we know that? Because the police would pull them over and ask them, what were you receiving in that? And they were too scared to lie. So they didn't lie. And that's when I get involved. So I am going to do some legwork on this, and that's Diane, you got a great point there. It's illegal.
And it's also a threat to the women that are there.
Correct.
If they are actually
Well, and then-
not, they're there against their will.
And sexually transmitted diseases potentially.
Well, that's the thing. It's a threat to them for so many different reasons.
The only way you're gonna really stop it,
And
I
who's going
think,
to monitor their health,
Right.
and which will affect the health of people who are
Going to see
enjoying the foot massage.
Yeah.
the only way I can see that you're gonna really cut it back is you're gonna have to not tell anyone you're coming and just constantly go in there and check them out, I guess. I don't know, maybe.
Well, I did do that, and I closed all three of them, and the fourth one went away all by themselves.
But I mean, like once a week, and don't tell them when you're coming, you're gonna just walk in there and see what's going on.
But still, women are being trafficked through the night. I mean, this place here, on their Facebook page, they had 6, 7, 8-year-olds on the website, and it said, new girls coming soon.
Oh my God.
So,
You can't use the
Why
historical
aren't the
data.
police doing anything about this?
Well, they did.
we do, we closed all 3 down, but it's still bigger than that.
And did anybody get prosecuted? And did any of these children and all these young women
That's what I mean.
receive any protection?
They just, no.
It's not like
That's
a
terrible.
television show.
Yeah.
We just said, go away, and they're still being abused.
Yeah, they're just gonna move to the next place, that's all.
Yeah, but if we can not have them here at all and be part of this, participate in this, is horrifying. If I can make a stand, like I said to Mark, if the board can prohibit a synthetic drug, they should be able to, in good conscience, prohibit this type of situation. But I understand what Mark's saying, we don't want a lawsuit.
Yeah.
Okay, so, and then if all else fails, and Mark doesn't think that what we come up with is enough, then I will ask zoning to zone them to a less desirable place like tattoo and other,
Have we reached out to Cheryl to see if other towns have gone down this pathway?
Yep, I asked her. She doesn't know of any that has banned it. She thinks Cambridge and Sudbury zoned it, but she does not think the board banning it is illegal, but wanted me to check the towns.
There's gotta be a way that we can ban it.
Yeah.
I mean,
Some words.
we've gotta put our heads together and see what we can come up with.
Yep, well, I'm gonna call that task force tomorrow at the AGO's office and ask them for a little bit of help too. And just so, I know Diane, you weren't sure about what it was. This
Yeah.
is the definition, and Kim too, and Jeff.
I looked at that.
It's kind of a crazy, and I say refer to practices including but not limited to, so there's more words, I guess you might say. And they're very manipulative people who come here and do this. It's quite the thing. It's quite the
It's sad that
undertaking.
even if we banned it in our town, that they're gonna move to another town
Yeah, I mean, we
that
just.
allows it, and they're just gonna go to the next town, and it's something that the state should be more involved with than
The law
each
enforcement should be
municipality.
dealing with this.
Well, they do, but I can't, I mean, they got me involved. Right, so, I mean, that's, they're great.
So if they walk in and they see 8-year-olds,
Oh, I think that'd be.
what reason would they be there?
Yeah.
They just let it go.
I don't know, we didn't run into 8-year-olds, that was just on their
Yeah, because if
website.
you had an 8-year-old, you should probably be calling.
Yeah, because Kathleen has the power to shut the business down.
Yeah.
And have like an immediate response, you
I bet
know?
most of those people are underage.
I'm sure they are.
Some, actually, there were some much older.
I thought, that, yeah, when we went,
Yeah,
that
when we
time
went
I
in,
went, they
yeah.
were,
Much older.
Well, then they could do it.
Maybe we can get together with a few other towns in our area and talk about it that have the same concerns.
If you Google this, you can't even imagine how many towns have closed these places multiple times. Actually, one town actually called me because they heard the Board of Health's going in there, how are you doing it? And we all share our regulations and stuff, but I really think that we'd be first. And that would trickle down, just like Cradle,
Yeah,
but without a lawsuit.
let's try and do it.
I'm definitely gonna work on it. So if it's all right, I'll put it on the agenda for June.
Are we gonna meet June, or are we?
This is June.
Oh, we're in June? Yeah.
This is June. We're gonna meet. I mean, July and August we're off, right?
Yeah, so give me the summer to,
September.
Yeah.
Why don't you do that?
so it was September, I'll have it back on. the
And
agenda.
if you wanted to have an emergency meeting, maybe we could all do that too.
Okay.
But you're saying there aren't any of these establishments open here in Franklin?
we
right
do
now?
have reflexology and Reiki in town.
Yeah, it's different.
Okay.
Well,
There's,
acupuncture, reflexology, I mean, that was in this definition.
Acupressure,
You have to have a
TM.
license for acupuncture.
Yeah,
Yeah,
this is
I mean, they're licensed, so-
acupressure, TM, whatever that is. Oh,
And
They're
who's giving them the license?
licensed with the state licensure board
What's a license for?
to operate, to make sure that everything's
I know, but is it?
compliance.
It's not like an acupuncture license. It's just to operate, have a business.
Yeah, pretty much. I don't know, I mean, I don't do their job, so I'm not 100%. Massage therapy has to be licensed by the state. They came here for this particular place over here, but they can find, but it's all on the local, it's all back to us.
If I remember, it was one person that had a license,
yeah, only one.
and then there was
Oh, at Daylily Spa?
There's only one
remember that?
person.
There was one person, and she was never around.
Pull my hair out of my head with that place, yeah.
Well, no,
Gonna
but
say
they
that.
kept saying that they
They could be
they
located
weren't
somewhere
doing
else.
massage, and then
Right.
at the end they go, oh yeah, we have a license for massage, one person.
One person who's
Yeah,
not
I
there.
remember that.
Oh my God, that was.
I mean, it takes way too much time out of my workload
I know.
and beyond.
Yeah.
But I just wanted to kind of get ahead of the curve with this. You know,
All
I
for
figure
it.
we're on a pretty good roll. You know, let's just get behind it, right? It's bad.
Yep.
It's a bad practice.
Yep.
But, all right, so I'll come back in September with more information.
That'll be great, thank you.
Can we meet with other towns? We do it all in conjunction with them too? I mean, what, does it have to be just all by ourselves?
I think it's tough to do it with all the different towns.
Well, please.
Like
Because we have
Meeting and
370
chat about it.
I think what she was
No,
saying.
I know. Well, I mean, at least around, the towns around us.
I think what she was saying, if we can find a way to ban it, then maybe other towns will pick it up, and it'll be, just right down the road,
But if we all worked together and
We'd be
do it at the same
heroes.
time.
We'll be here, and you'll be a hero.
I can talk to Mark about working with Medway. Where's Mark? Mark Sorrell is in Medway.
No, Medfield,
Medfield, thank you.
Oh, he lives in Midway.
Yeah,
yes,
he works in Medfield.
halfway in between the two. We had a long discussion about that.
We're a little bit ahead of the curve. I mean, some of the surrounding towns don't even have updated tobacco regulations, so I would reach out to the people that I know, be more helpful, yeah. But, yeah, we could definitely work together and come up with a significant public health threat. Other than it being illegal. Carries wheels are turning.
I'm just, yeah.
All right, so you want, we're running.
Want to do your health agent report?
Yes. I'm trying to see if there's anything really like new to report, like not so much. I guess we're starting with all the food trucks for summer and all that stuff are coming in, so, me and Jenny kind of split those up, like whoever gets to it first, kind of. But I've done 3 of them, you've probably done a couple more. One residential kitchen I did, was that maybe yesterday, was the only time she had available, so a couple of those.
What was
and
the
then-
food complaint inspection?
Can we ask that? I don't know if I can even remember off the top of my head, to be honest.
It wasn't the.
They said, what was the food?
There's one
complaint?
food
Yeah, it wasn't,
complaint. It wasn't the-
it wasn't a reported foodborne illness. I think it was more like a complaint about an establishment.
In May?
In May. I can't remember off the top of my head. It was something like that. I can let you know. I just don't remember off the top of my head.
Usually we talk about it.
Yeah.
Maybe you could put the initials on your report next time, like so Jarvis, you know, Kentucky Fried Chicken.
Yeah, I don't.
We don't even have to use
those.
It was something
That was a
very
good
small. It
example.
wasn't like an illness problem, but
It could be beer can contact, it could be not wearing a hat, it could be a number of things.
mouse.
I know, trying to
Grocery
think.
store, Big Y? No.
Yeah.
You got that one today.
I did, yeah.
That was just I know.
Which hat do I want to put on?
That's how I'm feeling now too.
That's all right, we'll get back to
I
you.
don't remember what it was.
No, I don't know. That was pretty much it. Regular regular inspections. I got to a lot of the re-inspections
you're
this
right,
month
Ellen.
as well. And then I did a really informative foodborne illness training. It was like combined epidemiology and foodborne illness, and like the whole concept of when Alicia or nurses get it and report it to us and all the steps. It was 3 full days, really intensive.
Nice.
I don't think they stopped once, but it was really good information. So that was nice one too. That's pretty much it. Just standard day to
All
day.
right, thank you.
Alicia.
Alicia.
Communicable diseases, really little, I know. So for COVID, and this data is from 5/28, so it's subject to change, sorry. During the week of 5/10/26 to 5/16, there were only 114 confirmed COVID cases and 25 probable in Mass, and we only had 1 in May when I went and ran the report versus 5 last month. Reportable. Respiratory illnesses, just so we know, this information from May 10th to May 16th, an estimated 10.1% of emergency department visits were related to acute respiratory disease, but it was very low for COVID-19, influenza, and RSV, and the influenza-like activity was minimal for Norfolk County. But tick season is upon us. I hear there's been a lot of hospital visits for ticks, so just be aware when you're outdoors. If you have use an EPA repellent, check clothing, pets, and do tick checks. And there was a Facebook post about this on our health department site if you want to go and get more information on ways to prevent tick bites.
Can I just add, there's a new tick in town?
You know what?
The Lone Star
New
tick.
tick
Oh, the
in
Lone Star
town.
tick.
Star, yeah.
We did have a case of alpha-gal syndrome, I think that was last month.
And what does it
too.
do to you?
Oh, it's the worst.
So on top of like so the Lone Star tick like transmit when it bites you the alpha-gal protein, and it creates like a sensitivity, and people get an allergy to mammalian products like meat products, sometimes even dairy products. So when you consume meat, sometimes dairy products, like 6 to 12 hours later, you will have a
Either a mild
reaction
or yeah.
to having those products. So basically, what you do is don't eat mammalian products.
Wow, good thing I
Yes.
don't eat it.
You can tell the difference because it has a little white spot
Yes.
on its back. So if you find one on you, you want to get tested right away. So I just wanted to talk
Wow.
about tick and town.
Yeah.
Does it affect animals too? Like
Not
a
that
dog?
I'm aware of in the same way. So this tick has been around for years, however, not so much in Massachusetts, and it was more located in like the Cape areas, but now it's kind of moving around more. So So we're seeing it now in other places. And I get to investigate that, so if someone does have alpha-gal syndrome, I will follow up on it. Central Park Terrace, I did the brain gains, blood pressure, and blood sugar clinic on 5/6. Continue with bi-weekly local Board of Health webinars. I have my Student Wellness Committee meeting on 5/5. My Franklin Crisis, what's it, the FCAT? I forget what the
Action team.
Action team, thank you. On 5/6 at the police station. I did an immunization update on vaccine preventable diseases on 5/6. I went to Springfield for the Massachusetts Public Health Nursing webinar for 2 days. Senior Olympics, we had a great time for 2 weeks last May, and I taught hands-only CPR for community members on the 19th.
What was
Many,
the-
many thank you to you for disinfecting the
No one got,
and that you only.
no one got poison ivy except for
you.
me from me disinfecting that with
What
Cabby
was the
wipes.
Senior Olympics?
Oh, you don't know the Senior Olympics?
No.
Everything from bocce to 1 mile runs, walks, chair
What about the
volleyball,
axe throwing?
darts, axe throwing, pool.
missed
We
it.
did a field goal kick and the ball kept going into poison ivy, and I go into the poison ivy to get it. And they're like, that's poison ivy. I'm like, yes, it is. It's okay. I only got like a little bit on my ankle. It was fine. And then, but that kept happening.
I have the silver medal in chair volleyball.
Oh, you were there?
Oh,
Yeah,
yeah.
we just
My
had the
husband has
ceremony
the
last
gold.
Friday. It was really cute. And then I continue with all
I
my
missed
nursing
that
care,
too.
and there are all my beautiful pictures. Thanks for having it
I
in
didn't
color
remember.
for us, so you can see how
Gotta go
great
to Senior
everything
Center more
looked.
often.
I guess I did.
You sent it to me.
I try to go once a week with my dog.
Well, but you
Yeah,
need to
that's
look
it
at the
for me.
stuff because it was all over the place.
Thank you. And I'm
Never saw that
laughing,
dress
I'm
that they
thinking,
had
here, we should have this meeting at 10 o'clock in one more, I'll watch shower.
My eyes are like.
We're so tired. It was so funny. If it was 10 o'clock, we'd be like, bing, bing, boom, boom,
Everything.
We all had such busy days.
No, especially today, the camp records make my
She's gonna be
eyes.
25 in a couple of weeks.
Wow.
I tell you, kiddo, I was
All right, so.
Hey, great job.
Thank you, Lisa.
I think, and then were we gonna talk about eventually synthetic cannabinoids?
We can.
Or did we kind of do that with the crack?
I know we already. We banned all
Because that was
all
part of
these
that.
stuff.
That's the sale, but maybe not the distribution.
No, we did, yeah. Yes, I'll put it on the future agenda.
Yeah.
Thank you.
But it said right here.
I know, we did in terms of the sale of it, but
The
not.
manufacturing, sale, and distribution of synthetically derived cannabinoids, kratom, and unregulated novel intoxicant purchases,
So
which is an awful lot of stuff.
So we did?
We
Yeah,
did it all.
it was with the kratom stuff.
All right, so I gotta look, I
Just maybe go double check and make sure we covered everything that we want to cover, and if not, then we need to extend it to cover.
It's in the title. Everything that's, and then all the
I don't think we
unregulated stuff.
banned it, but all right, I'll double check and then, I'm gonna have to,
That one was flying under the radar.
I don't, no, we talked about it and it's here.
Well, no, I know, but our discussions with the open hearing was probably more kratom focused.
It was.
But it was on that.
all right,
On
let
the
me double check
regs.
that. Cause I may have to look at,
Are we,
dispensaries now. So that'll be a different look.
but that's, they don't, it's all here.
We'll let her review it. And then-
Yeah, well, yeah, I mean, if you did it, it's a lot.
It is a lot. We've been very,
But
we've been very
limited to
busy.
Delta 8 and Delta 10, it's everything. Not the stuff that dispensaries would have.
Not this.
Well, that's, I mean, the dispensary should just have natural.
Well, unless they're.
No, they have
they're doing-
synthetic too, I think.
Well, they shouldn't.
Synthetic THC, which I heard is much better. But anyways, let me look into it. I don't feel like I've got enough info right now. Okay.
I don't know, manufacturing, sale, distribution, it's all there.
So,
How could we not have done that?
Are they selling synthetic THC?
I think I was just, I'm sorry, I think I was, Diana was just so focused on the kratos.
Yeah,
That,
but I made
But
sure
that was-
that
that
we were,
was on
that we
it.
talked about everything.
all right, that's fine. So I'll draft a letter, share it with you, and get it to the places where I think.
Are we going to be checking to see if their compliance, now that the ban has gone into effect?
We already did.
We
it's all done.
They what?
We went through, we made.
They told us it's all done. I mean,
Oh, you didn't go, you haven't been in?
We not.
like, when we used to, like, look, how we, like, if they're hiding it, how we find
Yeah,
it?
I have to trust some a little bit.
Yeah, you wanna keep a good relationship, not be like, show me your-
Exactly.
You're very trustworthy.
Yeah. Well, it's not the word trust, but good relationship. Because they know it's gonna happen. If I
They know
don't,
what's gonna
so
happen, yeah.
If they don't,
Oh, no, I got rid of everything.
okay.
Well, good.
All right, good.
And then we should be coming up on our nicotine re-inspection soon.
Yeah. All right.
It's really been that long. Wow.
Yeah, because
Tobacco inspection. I think we have that September.
I think it's September.
Pretty sure it's on my calendar. Okay. All right.
that'll be good. No other business. Do I have a motion to adjourn?
I make a motion to adjourn.
I second that.
Any discussion?
Nope.
Jeff, how do you vote?
Yes.
Diane, how do you vote?
Oh, yes.
And I vote yes. We're adjourned.
We're adjourned.
We are now producing this in collaboration with Franklin TV and Franklin Public Radio. This podcast is my public service effort for Franklin, but we can't do it alone. We can always use your help. How can you help? If you can use the information that you find here, please tell your friends and neighbors. If you don't like something here, please let me know. Through this feedback loop, we can continue to make improvements. And I thank you for listening. For additional information, please visit franklinmatters.org. If you have questions or comments, you can reach me directly at suresteve@gmail.com. The music for the intro and exit was provided by Michael Clark and the group East of Shirley. The piece is titled Ernesto Mañana, copyright Michael Clark and Tintype Tunes in 2008, and used with their permission. I hope you enjoy. By the way, you can also subscribe and listen to Franklin Matters Radio on your favorite podcast app. Search in podcasts for Franklin Matters.